Hello guys, I hope all of you are doing well, and the main purpose of making this video, as you can see on my screen, is to make you aware of how to use one-touch pharmacology for either for revision or for the last leg of revision, or even if you have not done entirely pharma, then how using one-touch pharma you can excel either in the NEETPG exam or the FMGE exam. So many of you have asked for this video, so I'm doing that. Right, but before that, I would like to thank all of you for receiving this book in an amazing way. And I could not even imagine that you guys have made this book as #1 bestseller right within a few days of its release in Amazon. So anyways, coming to this book, many of you have already received the book, right? And many of you will be receiving in a short time, right? The books, they have been dispatched for the winners of 100 giveaway copies. And to begin with, what is there in the book, right? First of all, many of you have messaged me, sir, we are finding it difficult to revise entire pharma. And for revision, how can we make it concise? So I've done that for you. I've concised my entire lecture, the theory part, into just 42 pages. Yes, 42 pages with a judicious use of the space in one page. I've tried to compile one topic in only one page, like anti-epileptics in one page, antiarrhythmics in one page, pharmacokinetics in 2 pages, pharmacodynamics in 2 pages. So likewise, by using that, in 42 pages, I've tried to compile entire pharma. Now what that going to do is, #1, reduce the burden for revision on you. #2, when you have entire topic in one page, that creates a pictorial memory of that topic, irrespective of what exam you are preparing for, NEETPG, INICET, FMGE. This is how this revision book is going to help you. Now, so apart from the 42 pages of theory, what else we have here? In this book, we have around 3 pages where I've given you some important images which can be asked in pharma. Around 5 to 6 pages, there are drugs of choice specifically. I have alphabetically arranged them. I have 1 page for antidotes of choice in this book. And finally, I've given you previous year's question of last 3 years in this book as well. So let's begin. I'll give you just a demo of how this book is color coded to help you for revision. And even if you are starting with pharma, then how this book can help you. So let's begin with decoding how to use one-touch pharma for maximal benefit. So let's begin with the first topic, general pharma. See, if you begin with general pharma, the majority of the MCQs, they will come from pharmacokinetics and dynamics. But if you look at the page of introduction, we have some topics like definitions in pharma. We have some definitions in pharma and routes of drug administration as well. Now, if you look at, there are 3 colors I've used mostly in this book: black, blue, and red. Now, the black color, they are just for the terms or introduction like mechanism of action, side effect, or the terms. Blue color I've used for those which have been not yet asked in the exam, or less probability of being asked, or they've been asked but very rarely asked, right? But then, so pharmacology, pharmacotherapeutics, chemotherapy. So pharmacology, pharmacotherapeutics have never been asked, but chemotherapy, it has been asked. And what they ask, I have coded it in red color. So you have to annote the previous year's question, right? But you don't have to do that with this book, because I've already taken care of that by color coding the red color. Whatever you'll find in this book in red color, they are the PYQs, previous year's questions that have been asked in INICET, NEETPG, or FMG. So it's going to help you, right? So pharmacy or even drug, they have never been asked, right? But pharmacokinetics, it has been asked sometimes. What is pharmacokinetics? What is pharmacodynamics? Now look at the types of drugs. This is another topic, types of drugs. Now here, if you see in red color, I have marked one thing, that is Schedule H. So what is a prescription drug? It is Schedule H drug. Now OTC drugs, they have never been asked. Essential drugs, it has only been once asked, and they've asked you, I have marked it in red color, that they are not FDC or fixed dose combination, they are single molecules. So I've only marked that part in red color. Second, orphan drugs, these are drugs for rare disease, so I've already marked that in red color. So similarly, spurious drug, they've asked you, of 500 milligrams of tablet has only 250 milligrams. What is it? Spurious drug. So in these types of drugs, you can see You have to read everything, but your focus should be more only on the red color. So now let me tell you how to go about this. So if you have not at all started with pharma and you're beginning to start with this pharma, either with the main videos or revision videos, so you can use this book as a complement and go through these points and read each and every point if you're going for the first thing, right? First revision. But your focus should be more on the color coded, the red color ones, where the MCQs, the chances of an MCQ being asked is more, much more. Now, many students, they have asked me, sir, we have done pharma from some other source. Can we use this book? Yes, you can use it. The reason being, it does not matter. Uh, Whatever platform you have used, pharma is still pharma. It does not change, right? So these are the red color coded which you can use it. This first category, if you're starting with pharma, right? If you've never studied pharma, I mean to say for competitive exams. Suppose you are using it only for revision. If you're using it only for revision, it is first revision, you can use it. You can read the content because you have already studied it. You don't need to watch any video, anything. Just read it, but focus more on the red points. And at last, going for the last revision, how can I use this book for last revision? So see, when you go for the last revision, one small revision before the NEETPG exam or FMGE exam, you don't need to read the entire book. So you take one page for last revision. What you need to do is just go through the page, and going through the page, just go through the red points. The red points, like for example here, see, route of administration systemic oral, it is usually not asked, but here you can see rectal route. What MCQ they ask is, how is it different from oral route? 50% lesser first pass metabolism. Intravenous, the only thing they ask you, which is the only route with 100% bioavailability, right? Subcutaneous, it can cause pain and necrosis, so not to be given, avoided by intramuscular route, right? And pulmonary route, it is fastest effect, that is IV more than pulmonary. So these are the red points which I marked here. So you can just frequently go through these points. Similarly, if you can go to pharmacokinetics, you can say I mark the red points, whatever they ask you. For example, for absorption of a drug, most common mechanism is passive diffusion, and drug must be lipid soluble, non-polar, unionized. These are basic stuffs. But coming to Hasselbalch equation, the only thing they've ever asked is what is pKa. So I marked it in red color. It has been asked multiple times. Bioavailability, there are two MCQ points they ask you. It depends upon what? Absorption and first pass metabolism. And area under the curve, or bioavailability, or F, it is a marker of what? This has been asked. And your answer is what? Extent of absorption. Only route with 100% F for bioavailability, IV. Again, I marked in red color. Similarly, concentration time curve, rate of absorption is determined by Tmax. So again, I have marked this in red color. So similarly, if you go through this entire book, you'll find in distribution, pharmacokinetics, metabolism, excretion, I have marked those points which are important. Like you can see here in pharmacodynamics, I have marked DRC in red color. It means DRC is very important, right? Types of antagonism, you can see I have marked here in red color only these points, that what happens in competitive, reversible, or non-competitive antagonism. So which means what? This is my area of focus, right? Pharmacodynamics, if you look at receptors, I have marked only few points which are important. ADR, pharmacovigilance, drug schedules, right? Similarly, here you can see clinical pharmacology, clinical trial, some points. So with 4 to 5 pages will be done with G Pharma. Autonomic nervous system, if you look at the introduction, then there are only few red points which are important here for MCQs. Most are blue. That means the blue colored points here, MCQs are not asked, but they're important to understand the drugs. So if you're doing a first reading, you can read the entire content so that you can understand drugs. But if you're just revising it, then in that case, just go through. In this entire page, there are a few points above, and only one point in receptor they ask you is beta-3 receptors. They do what? Lipolysis, or they're present in adipocytes. The only point they ask. So I marked it in red color. Similarly, if we move ahead, then parasympathomimetics in one page. In one page, entire classes in parasympathomimetics is here. And here, whatever are the important points, like the most important points are drugs of choice. So I've already, marked them in red color. What are the drugs of choice here? Or atropinization, what is the most commonly used or most specific marker of atropinization, and other uses. So parasympathomimetics in one page, Parasympatholytics similarly in one page, sympathomimetics in one page, and sympatholytics in one page. And I've already marked which are the red points which are important for MCQs. Then finally we come to one page called as note page. Now this note page is important for whoever is doing the first reading, right? So if you're using this book entirely for your first reading, you can do that. So if you're watching a video or if you're doing Q bank, so suppose I'm watching video or I'm doing Q bank, and by doing that, if I get something new information, right, which is not in the book, and I think I should add that to the book, then you can use this note page that I've given, right? If you're using it only for revision, you don't need to do that, right? But if you're doing it for first reading, you can do that. So the notes page is for that purpose. Similarly, cardiovascular system. So what I've tried to do in CVS is again one page, one topic, like antiarrhythmic drugs in one page. And if you remember, this was the latest MCQ asked, that asked you QT prolongation, or this graph was given, and this graph change is caused by which class of drug, which drug, quinidine. So all the antiarrhythmics in one page, heart failure in one page, right? And all the important points are color coded in red color, which are most important. Similarly, vasodilators are in one page. And again, see the important points, let us say calcium channel blockers. The drugs of choice are important. I've color coded them in red color. Two side effects which are commonly asked is what I've colored, made it red color, that is constipation, ankle edema. Similarly, RAS inhibitor C, the common side effects are never asked, so I'm not made them red color, but contraindications are commonly asked, so I made them in red color. So similarly, if you go through other serious disorders like hypertension, angina is in one page, hypolipidemic drugs it is in one page, and I have already color coded what are the important points here, and notes again comes. Similarly, kidney, the entire topic of kidney is just in one page, you can see. So I have used one page to discuss the entire army of diuretics in one page. Sequentially, I have mentioned the red color. Like for example, acetazolamide is drug of choice in mountain sickness, is the most commonly asked MCQ, right? Or other, which is drug of choice in cerebral edema, or which is drug of choice in case of pulmonary edema, or the side effects, whichever they ask you. So I've color coded them, the vasopressin and the related drugs. So one page, diuretics, you are done, right? Notes, then central nervous system, again I've done the same thing. Anti-epileptic drugs in one page, all the important stuffs of anti-epileptic drugs. Sedative hypnotics and neurodegenerative disorders in one page. Now see, sedative hypnotics, what I've color coded here, you don't need to remember the entire army of benzodiazepines. Just remember which are the short acting benzodiazepines. I've only color coded that, and what they ask you, which are safer in liver failure, elderly, or which have no active metabolites. And you know, liver failure safer, it has been asked multiple times. I've color coded remimazolam because it is the shortest acting benzodiazepine. It has a high probability of being asked. Others are drugs of choice or important points in Parkinson's disease, etc., which I have marked here. Opioids, alcohol, and smoking dependence in one page, all the dependence in one page. Again, you can see the red color things, they are marked here, which are the important MCQ points. Antidepressants, anti-mania drugs. Now, if you look at antidepressants, for example, let me tell you, MAO inhibitors, have I color coded anything in red? Means MCQs are not asked. Tricyclic antidepressant, are they commonly used? No. So you can see in tricyclic antidepressant, there are very few points which I've color coded. And one of the important here is the drug of choice in case of toxicity is sodium bicarbonate. This is the only color coded point because the reason being this is what is commonly asked, right? Sometimes they ask you about side effects where other receptor block like muscarinic block can cause urine retention or mydriasis, right? And here sometimes they ask you like in case of glaucoma, which antidepressant should not be used because of mydriasis, your answer is tricyclic, or BPH, again, your answer is tricyclic. SNRI, mostly they ask you about which one causes a withdrawal symptom, it is marked. SSRI, everything is important. So you can see here, SSRI have marked everything in red color, right? Side effects, see, side effect is in red color. It means all side effects are important. So similarly, lithium, you can see lithium, there is a lot of red in lithium. There is a lot of red in lithium, which means what? Lithium is a very important drug, right? Automatically. Now you can see here, we have antipsychotics and antipsychotics, typical, atypical antipsychotics. And I've already marked few points here, which are important for MCQs. The notes. Then comes antimicrobial drugs. Antimicrobial drugs We have antibiotics in 2 pages, antibiotics, cell wall synthesis inhibitors in 1 page, right? Antibiotics, protein synthesis inhibitors in 1 page. I marked all the important red points which are important for MCQs. Other antibiotics in half of the page, plus in half I have antifungal drugs. So antifungal drugs I've also marked which are the important points for MCQs, right? And then antiviral drugs, non-retroviral, antiretroviral drugs I have in 1 page, which are the important points. Anti-tubercular leprosy drug in 1 page. Anti-helminthic, anti-protozoal in 1 page. So we are done with your antimicrobial drugs. Anti-cancer drugs in 3 pages. 1 page for anti-cancer drugs in drugs of choice in the image, right? Bone marrow cancer and solid tumors. Second is side effects. Side effects, which are again in the form of image, plus prevention of anti-cancer drug toxicity, antidose. Everything is red because these are all important. MCQs are asked, right? And finally, classification of anti-cancer drugs. See, in classification of anti-cancer drugs, you don't need to mug up everything. Try to remember as much as you can. I've color-coded some things in red here, which can be asked as MCQs. Then endocrinology. See, endocrinology, diabetes mellitus is the most important topic. So in anti-diabetic drugs, I have dedicated 1 page to insulin because insulin is an important drug. And again, the red colors are, you can see, the color-coded ones. Like most common site of injection is abdomen, or cloudy white insulin, or similar rate of absorption glargine, what is lente. These have all been asked, right? And other anti-diabetic drugs in 1 page, like drug releasing insulin, or metformin, or thiazolidinediones, all these drugs. So all of these are all color coded as well. Now the other drugs in endocrinology, for example, growth hormone related drugs, GnRH related drugs, we have covered in 1 page. And drugs acting upon reproductive system, we have covered in the same page. And finally, at last, we have drugs used in osteoporosis and thyroid disorders in 1 page. And finally, some points which are important about steroids. Now see, I have made here a note that learn about the steroid use in clinical subjects so that we don't increase the load for revision in pharma. And side effects of steroids are nothing but presentation of Cushing's disease. So I can learn from there, right? Autocoas, similarly, antihistaminic and serotonin related drugs in 1 page we have discussed. NSAIDs, about NSAIDs and the inflammatory disorders like gout and rheumatoid arthritis in 1 page I have discussed. And you can see here the most of the red, they are again the important MCQ points which I have color coded so that you don't have to work extra time, right? Similarly, respiratory system, you can see in 1 page, drugs used in asthma, antitussives, right, anti-leukotrienes, etc. All of these drugs in 1 page. So 1 page, respiratory just 1 page. Gastrointestinal tract, you can see here, peptic ulcer disease, I've discussed in 1 page. And the color coded are the red ones. Prokinetics, antiemetics, laxatives. 1 page GIT, we are done, right? Blood. Now see, blood, in case of blood, anticoagulants, the oral and parenteral. So in 1 page, we have the anticoagulants. Again, it is color coded. Antiaggregants, fibrinolytics, and hematopoietic agents. They are in other page. So blood is done. And the last topic is immunomodulator. Immunosuppressants in 1 page. The most important MCQs which they ask on immunosuppressants is about mechanism of action. So you can see here, most of the things which are marked here as red are the mechanism of action of immunosuppressants. Side effects, there is one class of drug where they ask side effects, cyclosporin, tacrolimus. You can see here, the side effects are there marked in red color. So with that, we are done with immunomodulators. So I'm done with the theory part. So in 42 pages, I can quickly revise or study pharma. So you had a problem. Sir, we are not able to revise pharma because it is vast. I've solved that problem for you guys. Now images, there are a few important images which are asked, like amiodarone causing blue-gray syndrome. It has been asked. Or for example, purple glove syndrome, acute dystonia with antipsychotics, libido reticularis with amantadine, flagellar dermatitis with bleomycin. So all these are important MCQs which can be asked. Finally, new drugs. Now see, new drugs are important only for INICET. They're important only for INICET. So if you're preparing for NEETPG and FMGE, give a miss to the new drugs. Now coming to drugs of choice. see, I've alphabetically given you drugs of choice in around 4 to 5 pages. You can see all the drugs of choice are there in 4 to 5 pages. All right. So how am I gonna use this drug of choice? So see, I'll tell you a routine. Until the FMG exam or NEETPG exam, what you can do is make it a point every day before you go to bed at night, revise 5 drugs of choice every day. So make it a habit. Before I go to sleep, how much time do I need to revise only 5 drugs of choice? How much time? Maybe 5 minutes max. And before I go to sleep, I'll revise 5 drugs of choice, whichever I have studied yesterday. And it's obvious I might not remember one or two, so I'll re-revise them. So by doing that, I will remember entire drug of choice by the day of exam. And remember, in pharma, if you remember the drugs of choice, they're on your tips. Half of your headache is gone in pharma, right? So this is how you can use the table of drugs of choice. And finally, drug toxicity treatment, 1 page for antidotes. And the antidotes are commonly asked. Dialysis is done or it is not done for which drugs is commonly asked. So 1 page. So like DOC, you can remember antidotes of choice as well. And finally, question papers are there, and these are the question papers which I've given. If you want, you can go through this question paper, right? But here in this book, the most important part or the cake is that 42 pages. The cake here is the 42 pages where we are covering entire pharma. And if you ask me how many MCQs can be asked, because it is only 42 pages, I'm telling you, this is the highly condensed version of my notes. There is a reason why here in NEETPG or FMG, almost 90% of questions will be asked from this content, because you see, the topics are repeated. And that is the reason why we focus more on those topics which are repeated frequently. So that would cover the entire pharma. So guys, I've done my job and I've made you available this highly condensed form of entire pharma for quick revision, last minute revision, or even to cover pharma for the very first time in a quick manner so that it is more productive. It was a demand, and necessity is the mother of invention. And you guys wanted it, so I worked upon it. I made it available to you. And I hope this book is gonna solve a lot of headache for you guys, especially keeping revision in mind, because pharma is a vast subject, plus it is highly volatile. And that is where this book comes in, and I hope will play a greater role. And thanks a lot for all of you guys who have shared me the reviews of the book, and that you liked it. And this is a kind of a positive reinforcement that keeps me moving on and doing greater things in pharma, so that it can ease your lives. So thanks a lot, guys. Take care. Bye bye.